He is the medical officer at Remote Health Solutions. Doctor, thanks for coming on this morning. It seems President Trump is learning more and more about issuing some sort of recommendation to wearing masks in public. We're hearing more and more about this. New York City, like L.A., telling people to wear these masks, but the homemade kind to allow healthcare professionals to get the others. But the question here, are scarves and that kind of thing really effective? What are your thoughts on that?
Yeah, thanks for having me on. So what we learn and what we know coming out from the CDC is a multi-layered cloth mask seems to be effective for general population. And I love the recommendation that they're saying avoid using these medical or surgical masks so that my staff, my team can have that protection. But I do love the sort of the brotherhood and the camaraderie of the American people that step in and are making masks. I know my sister and several of her friends have texted me, have emailed me, have messaged me saying, hey, we're making masks. Can you take these to work, or do you know people who need them? I think it's amazing. It
is amazing to see people coming together, but staying the focus here on the mask topic. Dr. Birx from the Coronavirus Task Force team had this to say at last night's press conference about masks. Take a listen.
Most important thing is the social distancing and washing your hands. And we don't want people to get an artificial sense of protection because they're behind a mask. Because if they're touching things, remember, your eyes are not in the mask. So if you're touching things and then touching your eyes, you're exposing yourself in the same way. So we don't want people to feel like, oh, I'm wearing a mask, I'm protected, and I'm protecting others.
So I wanted you to elaborate on that as being a medical professional here, because we didn't come out the gate saying, hey, social distance and wear a mask. It was like, that's not going to help you out if you wear a mask. Maybe if you're sick, you may not infect others in this way, but other than that, you don't need to wear them. Now we may be telling folks a different story. Why is that happening now?
Well, I think what's going on is we're gaining more and more knowledge about the transmissibility of this virus. And also we're learning that not only is the social distancing important, but as we get out into the environment, we think about the fomites, the areas where that virus lands on inanimate objects. And as we touch those, the mask is great. It takes care of part of the issue, but it doesn't solve all the problems. So you bring up a great point. We're still touching our face. We're still touching our eyes. But we can use the mask. That helps, but it's only part of the solution.
Okay, if we're told to wear a mask, we're told but obviously leave the other ones, the professional ones for the medical field. But what do we make it out of? We're told makeshift masks are okay. You make and wear a scarf. But for those at home, what do you make a mask out of, Doctor? I'm just curious.
Yeah, so what I'm seeing is multi-layered cotton or muslin. Basically, the recommendation that I read from CDC was multi-layered cloth of some kind, and I don't think there was a specific beyond that.
Something with cloth. Okay, so perhaps a scarf would work if you have a scarf, or maybe a bandana at home. Your thoughts?
Yeah. Those the bandana's actually been mentioned already, but I do think the key here is they mentioned very specifically that multi-layered is important. So one layer is helpful, more layers are better.
Are we going to eventually tell people, hey, now wear gloves and also cover your hair? I mean, sometimes if you read a few reports, they're saying, hey, you may need to cover your hair as well. Is there any truth to that?
I haven't read that yet. I haven't seen that, and I know that. Even in the ER at this point, that's not being one of our main recommendations.
Okay, very good. So again, if you're wearing a mask, that's something that you could possibly make at home. You can wear a scarf, you can wear a bandana, really anything you can to protect others. I think that's kind of what we're seeing evolve here. Dr. Jon Baugh, if you don't mind sticking around, we'll talk to you in about another hour. That's Chief Medical Officer at Remote Health Solutions. Good to see you, and stay safe, sir. All right, Nan Hayworth, she's going to join us now.